Hello, everyone. Happy tax day. Is there such a thing? God, I was up late last night. It was ugly. My accountant called me and he said, I don't have a couple of things I've needed from you for a while, Jeff. And I said, oh, that shouldn't take me but a minute or two, and didn't work out that well. But anyway, on a couple hours of sleep, it's tax day. At least that part of it is behind us. So welcome to Humpday Happy Hour, hosted by Dennis in the Know. This is the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We're pulling back the curtain on the industry, talking to the experts, the innovators, and the everyday clinicians who are out there doing the work. There's no fluff, no filter, and definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs, or maybe the latest scandal at the ADA, we are probably already talking about it. And yes, we are bringing the goods. So whether you're a seasoned doc, part of the dental team or industry, a curious consumer, or maybe you're just here for the banter, we welcome you all to the show. Because around here, we are not just in the loop, we are in the know. Hey there, Dinks. I'm Dr. Jeff Horowitz. I'm with two of my favorite people in the world, Dr. Jennifer Bell and Dr. Chad Duplantis. We are all educators. We are all dentists. And we are all here to bring you in the know. How was that? That felt so energetic.
You're firing.
I'm on fire.
Firing.
Scotty's on fire.
You're on fire.
How you doing, guys?
Better than Chad. How are you?
Yeah, Chad's having a rough day. You want to start, Chad, telling us about your rough day?
With a few less expletives. Just a few. Why, like 10?
My day has been fine, but I'm just going to say
fine, and I was like, "Oh, that starts with an F." Wait, hold on.
No, my day. My week has been perfect. StreamYard sucks. That's all there is. And StreamYard's the platform that we bring this to you on, and I don't get it. I really don't get it. I don't know what else I can do.
They don't like Texans. Apparently.
It must not.
Yeah.
It could be totally that.
Well, let me brighten your day a little bit and tell you that today's show is sponsored by Toothy, which we're going to talk about quite a bit. We're going to talk about the whole realm of AI. We've got Dr. Tom Rutner with us later, so that's great news. Great guy. We got to meet him a few minutes ago, and I think we got a good show ahead of us, young folks.
Agreed.
Yeah. So while Ted's sulking down there, JB, how was your week?
It's been good so far. Okay, so let me paint the picture. Has everyone, I think, because the data is actually suggesting that how I feel is correct. August, kind of slow, like September, kind of slow. October, kind of not. And so I'm now mad. I'm like, oh, I'm having to work so hard. And today was definitely one of those days where at the end, I was like, man, this is a lot of composites in one afternoon. And the last one won't take a nice light, and it's number 18. And I have to hold the tongue the whole time. And I'm just like, I'm getting too old for this nonsense.
Yeah.
So anyway, we can't be happy is what I came to the conclusion. At the end of the appointment, I wasn't happy when I was bored in September, and I'm not happy now that I'm having to do dentistry again. So I just clearly have a problem. It's the same with weather. I'm bitching if it's raining too much. I'm bitching if it's too sunny. It's too cloudy. I'm like every other female, maybe.
You're
I just can't be satisfied.
You're not supposed to be happy. Didn't anybody tell you that?
Oh, dentists are the most unhappy bunch of people.
So this is funny that you say that. I have done so many composites in the past 2 days that it's just really wearing me out. However, I'm going to say two things. One is I absolutely love one of our sponsors, the Garrison system. Wow.
Yeah, love it.
What a great system.
That is a great ring and matrix system.
Game changer. really, I've been using Ultradent matrices forever, and there's several that I've tried, but Garrison really has nailed it. So great job. Beyond that, I don't know if you all have ever done this before, but one of my favorite things to do is just to walk in my office and put my feet up on the desk and just kind of relax. And, you look at your phone, look at Facebook, the Facebook and the Instagram and do all that stuff,
You're so old.
Did you do a baby tweet?
Yeah. But beyond that, have you all ever sat there and been like, I have like one assistant, Cindy, that's going to always walk in and she's like, we're ready. Topicals on. Let's go place anesthetic. You're like, okay. Have you ever sat there for a second when it's a full day of composites and gone, I don't want to get up.
Yeah.
I think I'm tapping out. And the older I get, the closer I get to actually just sitting my ass down at that chair and not getting up and just like, screw it.
You're describing every day of my life when they tell me I have to come do a composite, Chad.
Yeah.
I'm telling you, man.
He's a lot older than you, Chad, and so he's already done. Like, he's mentally checked out now.
I love Crown and Bridge. I love indirect dentistry, but I don't think people realize it. And we had a really cool patient. He was like my third set of like 4 composites for the day. And I told him, I was like, dude, I go, here's the deal. Whenever you're coming in for fillings, don't set them up after lunch. Because we've kind of checked out at that point in time. It doesn't mean that you're going to get crappy work. There's going to be a lot more potty breaks and coffee breaks in the afternoon than there are in the morning. And I was like, composites are they're thought consuming. They're energy draining. I mean,
I get it. I thought the same thing to the lady today, the last one I did. I almost said, if you were smart, you wouldn't have booked this appointment. You should come at 8:30. I was a lot better, and my finger doesn't smell like beef jerky now because I just finally grabbed lunch.
Yeah. But you know what? It's great to have those conversations with patients. I truly believe it, because obviously we're jovial. It's a joke, we're always going to take the same care of them as we do everybody else. But that when we can have those conversations with people, it's a comfort level that you just can't describe. It's good. So at least
I'll say sometimes in the morning, like it's only 9 o'clock. I haven't had my second glass of Jack Daniels yet. So
true. My favorite is, hey, I'm going to go ahead. I'm going to give you this anesthetic. We're going to take a few minutes. I'm going to go grab a quick smoke and a cup of coffee, and I'll be back in a few. Yeah. And seriously, the patients will look at you like, are you serious? And I was like, yeah, I'll be right back. Just chill.
I'm just going to do a little bump back there, and I'll be right with you.
Dude, hey, you know what? Okay, we're going to do this.
The fastest dentistry you've ever seen in your life.
Hey, speaking of a quick bump, I want to do this.
I want to see where this is going.
I want to see this transition.
I've been dying to do this for years with you all.
I'm now genuinely concerned.
Hottest streaming series that you've watched or are watching right now?
How does that correlate to bump?
Well, if you've watched it, So The Pit, Jeff, JB.
The Pit.
Okay.
Love it. I am so sucked in.
Okay, JB?
Only Murders in the Building.
Ooh, that's a good one. So I'm going to throw this one out there. If you all haven't seen it, you got to watch it. Black Rabbit.
Oh, we already saw it.
Dude, I'm telling you, so many people have said I couldn't get into it. Ellen was like, I was like, oh, we need to watch Black Rabbit. And she's like, we started that last week and you fell asleep. And I'm like, oh, okay. So anyways, we started again. So tonight is our date night in the media room, and it's episode 8, which is the last episode. And I just don't know how the show is going to end well for one single person in that show. There are so many twists and turns.
You want me to tell you?
No, I don't want you to tell me, damn it.
What are you doing?
What is wrong with you?
What is wrong with you?
No. Or something? Shit.
Oh, damn it.
All right, I'm going to hold this over your head. I'm going to spit it out if you get ugly at me again.
Okay, so
I'm just going to blurt it out.
Do me a favor.
Yeah.
Write your show in the comments so that we can throw those out there, because I want to see what Jeff's watching. I want to see what JB's watching. But Black Rabbit. Oh man, that's a good one.
Yes. The Diplomat is coming back too, which I really liked. That was good.
And and I see Ted Lasso's coming back.
I saw that.
I'm so pumped. It's such a good show. That show just makes you feel good about everything in life.
Although it did get a little weird at the end, so I'm really hoping we like recapture the essence of that. Because when he was going, I'm not knocking mental health issues, but with a comedy show, it took a little darker turn and it wasn't as lighthearted to watch. So when I watch something that's deep and dramatic, I expect to get mental headspace to do that. When I was watching Ted Lasso, to your point, I was like, something that will make me forget I'm a dentist. Like, I can finally relax a little bit, you know?
You know what, though? Every great comedian, let's just take Robin Williams. Every great comedian has a dark side to them, and it's usually anxiety related. And, you know, it's part of their release. And, you know, I mean, it breaks my heart, but I think Jason Sudeikis probably suffers from it a little bit. But every great comedian does have, you know, that I know of, has some form of anxiety that really.
I can't remember what station it was on. We actually just watched a really good Robin Williams documentary. And I'll have to ask Jenny. I can't remember, but it was on, and we were kind of glued to it. It was a 2-part series, and I don't remember which streaming service it was, but I'll find that out and I'll put that in there because it was actually really, really well done, and a lot of his own footage, a lot of his family's footage, and it was just a really good. Not that anyone could ever get into that head, but pretty incredible guy. But anyway,
I've got some hard-hitting journalism here I need to get to.
Yeah, exactly. So we're going to run behind. We've got a great guest. We're going to talk about AI tonight. So let's let JB do her news.
Let's do it. Whoa, that was he'll be really fast to exit, and then he'll leave me out here super awkwardly for a really long time after, which is totally unfair. Okay.
That's how he reacts to the bump.
Now I can't do the news. Okay. Get off of my screen. All right, for real, the news, hard-hitting stuff. I'm going to start with which order should I go? Do I go like boring? We'll go boring stuff first, and then we'll hit with the heavy journalism at the end. A couple important things, obviously, going on in the government right now. Let's see. We have a government shutdown. A couple hostages were freed. Maybe we have peace in the Middle East. We'll see how all that transpires. But on top of all of that, even though the government has been shut down, it did not stop Bernie Sanders from getting an act together. He introduced the Healthcare Workforce Expansion Act. There's some really interesting things in this particular bill that he's trying to get passed. Now, this bill is for all healthcare, but dentistry is included in that. So I think that's important to understand. This isn't a specific dental bill. It's really meant for all medical services. Some of the interesting things that were included in this, all nonprofit. He wants to make nonprofit dental schools tuition free for students who commit to becoming a general dentist in rural communities, according to the most recent update on the bill. Also investing $5 billion in medical, dental, and nursing schools to boost enrollment. I'm not really sure I'm all in on that one. And it would also provide some relocation grants for doctors who want to move to underserved areas. Be interesting to really comb through the bill in all of its detail to make sure that, number one, it really is only addressing healthcare issues, and two, where the funding will come for a lot of these programs that they're trying to put in place. My biggest issue with this bill is that, at least in dentistry, enrollment in dental school is definitely not the problem. In fact, we're up almost 1,500, 1,700 dental students enrolled in or graduating from dental schools now every year. That's up from about 5,200 about 5 years ago. So I don't see that as being the big issue in dentistry. It might be definitely in hygiene and some of the other support roles, and maybe more so in medicine. So it'll be interesting to see how all that transpires. Another story coming out of California, Gavin Newsom's been quite busy over there working on some laws. related to medicine. He had a couple the other week related to how dentists are reimbursed and not being forced to take debit cards or credit cards from insurance companies. Another bill that he just put forward and was signed into law blocks private equity groups and hedge funds from interfering with patient care. This will be very interesting to watch because as this gets introduced, it starts in January of 2026. Now we're going to see where if healthcare institutions that are backed by PE firms and hedge funds are getting influenced or forced by those owners for patient quotas or certain referral decisions, certain like internal referral mechanisms, trying to dictate how procedures are to be done, who they're supposed to work with in doing those procedures, what types of tests should be performed, and who should those tests be performed on. It'll be really interesting to see if ultimately the medical providers will end up being the whistleblowers for what's going on internally in some of these different service organizations. I think this is both for medical and dental professionals as well. So it's good to see. Maybe this will continue to be the forward momentum, because it doesn't seem to be that we can really stop the investment of private equity into the medical space. I mean, that is continuing to grow at a pretty exponential pace. But putting laws in place to continue to protect the doctor-patient relationship, just like it should be with insurance providers as well, I think is always an important step to make sure that the integrity of medicine and dentistry stay intact. Now, I told you I was going to bring some hard-hitting journalism, and I'm not going to let you down. Yes, there are two, not one, but two dentists currently competing for the rose in The Golden Bachelor. Now, Jeff didn't mention that he's watching The Golden Bachelor, but I know he is. I know he's watching The Golden Bachelor because we used to watch The Bachelor together, and we would text each other during that time. That was probably really more of a dark time for me. I think he actually really liked it. I think I was looking for an outlet. That's really not here nor there. But the point is, there are two dentists that are competing on The Golden Bachelorette for The Golden Bachelor. One is Terry Alani and the other is Monica Parham. Terry Alani, I believe, is in California. And then, but she did, Chad will be pumped to know, she's in Texas. She's called the Texas Tooth Lady. She graduated from Texas A&M University before earning her dental degree at UT Health, Houston School of Dentistry. And she lectures pretty frequently within the Texas area. Dr. Alani also did a polar plunge in Antarctica, because I was reading this lady's bio and I can already tell you that she has done a lot more in her life than I have, which is really kind of embarrassing. And then Dr. Parham, who is from Tupelo, Mississippi, is also competing in The Golden Bachelorette. She did a practice residency in West Los Angeles VA Hospital, but she's currently active in Alabama. And she's busy with the Birmingham Dental Society and Alabama Dental Society. Now, it'll be really interesting to see if we get a bachelorette that comes to take the Golden Bachelor, who's a cosmetic dentist. I will be pumped. But I also warn the Bachelor, dentists are crazy. Not these two lovely ladies, but just kind of in general, we're a little crazy. So buyer beware. And that's the news.
If you win at The Bachelor, are you really winning?
I don't know. The success ratio is very low.
Yeah. I mean, that's my question is, if you win on that show, are you really winning? I don't know.
There's always a dentist on there too, man.
I just came up with a new meme just right now.
What's that?
That whether men or women have a better chance of getting it right than the Bachelor and the Golden Bachelor, or any other Bachelor or Bachelorette programs. And that says a lot, because statistically speaking, the whether man or woman is only right about 20% of the time.
For sure.
So.
All right. Well, listen, we've talked about everything.
Really everything.
But dentistry. I mean, barely we touched on a little, but I think what we need to do now is transition. We've got a great dentist on the show tonight, Dr. Tom Rutner from Northern California. And we're going to talk about AI. and maybe actually talk about the stuff that everybody tunes into. It. Actually, you know what? I don't even believe that. I believe they tune into us more to hear about the other stuff.
It's not the dentistry, you mean?
Yeah, exactly.
I think you might be right.
Yeah. All right. So, Chad, are you going to introduce our guest?
Yeah, but you know what? I'm going to ask AI to bring him up while I read his bio.
That's you,
Okay.
Jeff.
That's usual, yeah. So, and AI drops Dr. Jeff.
Yeah.
Down. But anyways, tonight I'd like you all to meet Dr. Thomas or Tom Rutner, who asked him his age, but he looks pretty damn young to me. He can grow a beard though, so that's impressive. But Dr. Tom Rutner owns 3 dental practices in Northern California. A little jealous of that. The College of Dental Medicine, so obviously he's smart. And he was the former class president, straight A's, 4.0. He's known for blending pragmatic strategy with forward-thinking innovation. Over the past few years, Tom has integrated AI across nearly every single part of his operations, from diagnostics to documentation, with a focus on implementation strategy and team mindset. What started as a curiosity during dental school turned into a passion after seeing the remarkable ROI from his first AI tools.
JB, are you?
He describes himself as pragmatic.
I was so worried it was me.
It impacts
Yeah.
there. That's the dentistry to go on enjoy. He is 49ers. He spends time with his wife, their toddler, golden retriever, and there's not much time left in this year, so I'd imagine that y'all missed all of that.
Yeah,
I'd imagine y'all missed all of that.
A lot of it, Chad.
No, we got more than the chances of winning The Bachelor or like staying together. Yeah, like 25%.
Yeah.
Enough to have a
you know
conversation.
what?
I'll have to have a conversation.
Can I read it again?
I would love for you to.
Yeah. I'm pissed because I did a really good job at that too.
You did a really good
Yeah.
You did a beautiful job. StreamYard
you
did a
really
good job.
Where did it stop?
Only about 30 places in the middle.
But we actually heard. That's what I'm saying. We did hear it. It was just in pieces.
Guys, don't worry about it. I just ran it through ChatGPT anyways. So.
Hey, there you go. He doesn't even know himself.
Well, you are the AI dentist, so that checks.
Here's the intro. Guys, this is Tom right over here, okay?
Okay.
He's old enough to grow a beard. He went to Columbia. He's smart as shit. He introduced AI into his practice. He's pragmatic. He's an innovator. He brings all kinds of stuff on. He's got a lot of technology in his office. He's a cheerleader for the 49ers. He likes to golf. He's got a wife. He's got a golden retriever. He's got a toddler, and he's going to have a baby by the end of the year. Well, he's not going to have a baby, but his wife's going to have a baby by the end of the year. So, and there's not much time left in the end of the year, so they're going to have a baby like within the next 2 months. And that's all you need to know, guys. This is Tom, class president, straight A's. Let's do it. Shit.
That worked so much better. I think StreamYard was like locked in.
Yeah. Where's that passion the rest of the time, Chad?
That was the best intro you've ever done.
StreamYard. Can you blur me out?
Yeah.
Yeah.
Welcome.
Thank you.
Welcome. Yeah.
Sorry about the.
To answer your question, today is actually my 32nd birthday. So.
Hey, happy birthday!
Thank you. And I've been able to grow a beard since I was 13 years old. So.
Where'd you grow up, Tom?
That's so lucky.
I grew up in Silicon Valley.
Okay.
Actually, my dad was the angel investor in Invisalign. So that's
no kidding. Very cool.
So, yeah, he was funny story. He was their president of Asia Australia when I was really little. And I didn't realize that he was not president of Asia and Australia, as in those continents. I was fairly certain of that until I was about 7 and I got corrected. But anyways, it was I guess I was a little older. But anyways. That's my funny story on that.
That's
I'd love to
really
be president of Asia and
that is
Australia.
awesome.
That's pretty cool.
Yeah. Well, about the same time, my dad was traveling all over the Middle East and Northern Africa on oil missions, and I thought that he was putting out the Kuwaiti oil fires. So, hey, you never know what happens, So
You never know.
So Tom, tell us your story. Tell us about your interest in AI. Maybe how you started your practice and what led you down this path and how different AI components have really transitioned your practice.
Would love to. Who doesn't love to hear the sound of their own voice? Yeah. So going back to before dental school a little bit. I got out of school, and like most of us dentists, I first had to fail out of medical school. So then I was just trying to work, do something for real. Worked at a startup, learned a bunch there that might play in later because I learned a bunch from that guy in Silicon Valley. And that was completely unrelated to dental. But my dad he was a dentist. I'm actually a 4th generation dentist. My dad had just sold off to a corporation. They needed office managers, but the office managers had to be college educated. In California, that's not super common. So they brought me on to be the manager in training. So I actually came from the admin side. So, I learned about medical billing and dentistry, things like that. About a year later, I sort of parlayed that into a regional director job at a different DSO as I was applying to dental school. So I go to dental school. With that as my background, I was a regional director.
Wait, you're a regional director for a group of clinics with a DSO.
It's very small DSO, but yes.
But it doesn't matter. That's pretty damn amazing experience to go into practice with. Like,
it was why I was voted class president. It was I was good friends with the class president for the first few years. My dad had said going into dental school, he's like, hey, you're going to know some things that it's going to be really annoying when you go to dental school for certain aspects, but put your head down and you'll be fine. I did so. And then clinic started our junior year, and we had a bit of a math issue. We had 40 chairs for 100 of us, and our school tried to say that there wasn't a math issue. And yeah, exactly. That was my look. And so I just sort of took it on myself to start acting like class president. Love the guy, but he was just not, he was getting ready to take the CBSE. I went to Columbia, everybody specializes. So they were all getting ready for their letters of rec and things like that. But the reason for the segue on oh my gosh, the work history is that my dad had decided to move up to Tahoe. So I was his office manager all during dental school. So that's what I did remotely. We moved to Curve, who we use now, and it allowed me to work as his office manager the entire time I was in dental school. So I still maintained that relationship, and then every break that I had, I would come back to, actually by then Tahoe, because my dad moved up here, which is where I am now, and so the staff knew me. They knew that was the case and things like that. And I was the COVID year. My freshman year, D1 year, was COVID. So I actually flew out here with my my now wife, and I got a typodont borrowed, and I just worked on fillings and crowns for 2 months. We get back into the pre-clinic, and nobody'd been able to pick up a handpiece for 6 months, and I was 1 month off of some pre-clinic work, so it takes an hour to get back fresh, and they had to restart our clinic entirely, our pre-clinic. All of that to be said, where AI comes into this is that so my senior year, I was our class president. I was the office manager. I was doing fairly well in clinic. I mean, we all have our numbers, and that part hasn't changed about dental school. And I was in the 100 kids. I don't know, probably somewhere in the top 10. It was pass fail, so I didn't actually have a 4.0. I had a P for all of it.
Congratulations.
Oh, thank you. Yeah. It was great. That was a great choice to go to a pass-fail school. My dad had a pretty big health scare, so he had to take 3 months off. It was actually 3 years ago tomorrow. It was the day after I took my boards on my birthday, and the next day my brother called and said, "Hey, Dad needs to go get some help." It was supposed to be a week. It turned into 7 weeks that he was entirely off. 3 to 4 months after he started sort of ramping back up a little bit. So I'm sitting there. It was the day after residency apps were due. Everything gets shut down for me, and I'm going into overdrive to get a locum tenens in here. We do keep it afloat and keep my job ready for me when I get out there. In that process, though, I definitely drop in our rankings in terms of, not that we had rankings, but I kind of didn't have any awards to be fighting for. I wasn't really, I had to take some time off of my clinic. I had to fly out here a little bit and put out some fires and things like that. So I'm sitting there. It's early March or so. We graduated in May over there. Early March, and I have, I don't know, we could graduate with as little as 10 fillings if we wanted. It was insanity. I'd done, I don't know, 100, 150, and I had 200 planned fillings in there, and I had a bunch of classmates that needed just encounters, just anything they could. So I'm just giving away just patients left and right. I'm pulling my strings as class president with the professors to let me to ship off these patients because I'd already met my requirements. So I was sitting there with my thumb up my ass the last 2 months. And sorry, I guess I should have. Anyway, I'm sitting there doing nothing. I'm doing nothing the last 2 months, and so I was like, okay, well, I just dabbled with ChatGPT. Was actually my intro, and I was like, oh, this is kind of cool, and I try out some things like that. And then I discovered, I don't use them habitually, but I found Gamma AI, which is like a fun presentation one. And with that, I was like, I don't really like the education that we've got on our website and on my office's website. And I'm like, well, what if I made a little quick hitter on what is a root canal and what does it mean from a patient? In 10 minutes, it made a nice, 6, I think that was an 8-slide little thing on what's a root canal, a little clip art, all that kind of stuff. And then I got real lazy and I started doing ChatGPT, make the outline for what I then put into Gamma. And within minutes, I had 8 of them, and they were good enough for me to put on our website. And so that's my start. That's my start in AI, was just seeing that kind of stuff. The first real clinical one that I saw was Pearl, which I think we're all pretty aware of. Pearl and Overjet, they're pretty big names out there these days. And my funny story, so I got that, and I showed my dad remotely, and I was like, we need to get this. It's worth it. And I showed professors, because I had it on Curve. I had it on my laptop. I could show professors in the clinic. And I showed one. She was younger. And the first thing she said, she's like, wow, that's really cool. It's going to make a lot of dentists really lazy. And I was like, this is a winning idea. If that's the worst thing you can say about it, like, I know it sounds bad. I'm not paid to diagnose. I mean, we're paid to do the exam. We're paid to take the x-ray. We're not really paid. It's not like radiology and medicine. We're not. We are paid to work. If this makes me communicate with my patients better, and which does, and there's more to talk about there, and it makes me find more, which as a new grad, that's always the number one thing with getting a new associate, is they don't see anything that's there. Sorry if I'm saying that to other younger dentists out there, but for a $3,000 investment, my last math said it generated $240,000 of restorative work in my first year as dentist. So,
let's pause there.
A little milestone. I did my 3,000th filling today. I thought that was pretty cool.
Oh,
okay. Very cool.
Sorry, that long-winded.
You can have fun with all that shit and do as much as you want. I have a question for you regarding AI.
Sure.
And you're a younger dentist, so do you see that AI, like, and I don't, you mentioned Pearl, but let's say Pearl, Overjet, the companies that are helping with diagnostic AI, do you see the potential for abuse of the AI amongst the profession?
I have seen it. Absolutely, there's abuse potential. There's abuse potential.
Abuse or misuse. And the question is that, and I think, and I'm going to preface this by saying that I truly believe that AI is one of the best things that has happened to dentistry over the past several years. I do worry because my mindset is always, they call it a second opinion. I think it's a third opinion. We need our radiographic interpretation. We need our clinical interpretation, and then we need the AI interpretation. And I find, I just worry that some people are going to see, oh, well, it's pink on this image right here. So by God, we're doing a DO on number 4. Whereas if you don't truly analyze the radiographs, you can abuse it. And I also see that what it's grown in my practice has been not necessarily the restorative aspect, but the preventative aspect of my practice. And that's something that I've really seen, that like, oh, hey, let's try and reverse some of these lesions, or at least halt some of these lesions. So what's your take on it? And with that being said, let's throw in there false positives and false negatives. So
yeah, there's definitely abuse potential. I think that even when we first got started, and frankly, I worked with my dad for a little bit before I bought him out about a year and a half ago. But he first year we were really working side by side, and yeah, he was real skeptical at first, and then it almost went to the other way. So he is somebody, well, he'll push the envelope. We found a few patients where we're like, hey, do you mind, like, we're not really seeing it quite as much, so testing out the false positive aspect, or like what could have been. And we'd correlate with some intraoral photos, and it was far less false positives than we thought, which was great. Okay, that gave us the confidence. Now we're starting to use this. And then we kind of flipped to the other side. And this was actually in the 2 months while I was waiting for my license. Welcome to California. Anyways, so yeah.
that's everywhere.
That's everywhere.
Yeah.
Yeah. That was actually funny. They sent me the wrong code because they didn't realize there were 2 different Dr. Rutners. So for 4 weeks, they actually were ready to process my license. They needed an email from me. And it was because they're like, hey, wait, is your birthday 2/19/58? I was like, no, it's 10/15. I was like, oh, yeah, this has actually been ready since June 17th. I found that out on July 12th. And then by the 14th, I was licensed. Anyways, sorry, I got off track. So it kind of flipped to the other side. And then objectively, yeah, we started doing a little bit of the, oh, it's pink, we're going for it. What I've found, and I've since had to dial back. So you absolutely, and there have been a handful of times where, now granted, I think that's going to be one of my main points, is like, gotta be willing to push the envelope and know when it's like, hey, look, it's not an egregious mistake, but don't make it again. I can count on one hand how many times I ended up going in there, trusting it too much, and then deciding I needed to change my protocol. So I had some mistakes, but like I said, I kept it to very, very few. And so what I've done now, and I've been doing since really the first 2 months of practice, kind of go in, I use it as my guideline. It's great to be able to really quickly look at my FMX. I can look at it, and with a couple of dots, I kind of already have an idea of this patient. You know what I mean? And see, okay, are we looking at big stuff, small stuff, things like that. But I just use it I more use it as an education tool, and as a second opinion. I actually kind of almost use it as the first opinion, but in a different kind of way, because the second opinion is always the right one, right? Your patient comes to you because they're not sure they really need that crown, but the other dentist says they did. It's always going to be the second opinion is the right one, in a kind of a thing. You already have the first set of data to filter through. So I actually use it kind of like that, where, and I say this all the time, it's a lot more aggressive than I like to be, way more aggressive than I like to be, but it's a data point. And so then my clinical exam is a data point. It's something I can show to patients, because this pink blob is a lot easier to say that it's a pink blob versus this type of gray blob. So I use it as a great education tool, but you definitely have to find your balance with it. You have to find what you're okay with, and what your patients are okay with, and things like that. But I can't deny that there's the abuse potential within there. So it requires a little bit of training up on it, but I think that it was really, really good for that new dentist who just is waiting for the classic enamel triangle, look that you look for in a textbook, that most non-Medicaid patients just don't have in the private practice world. I also look at my work as sort of preventive of the next step.
Yeah. I've got to know. So you started with Pearl. The journey didn't end. And I think it's interesting because it seems like maybe then it started creeping back into the original world that you knew, which was on the practice management side, because you had worked it, you knew it, You knew some of the pitfalls that were going to fall. So continue on your AI journey, and where does it look? What does it look like in your practice today?
Yeah, absolutely. And you're totally right. I think actually the AI in the radiology aspect is kind of very professional. It's very much you cut a check and you got that service. And then you find your way with it, like any other technology we got. Currently, you know, one that I'm really, and there's different levels of AI with a number of these things in terms of my interaction. You know, a lot of the companies I work with, I actually just work with the humans, and I know they are using AI. You know, my advertising company is using AI for SEO, for all these kinds of things, and lead tracking and how they follow up with people. And that's, you know, that's fantastic. The one that I'm working with primarily right now is called Toothy. They I was walking by at the Chicago Midwinter, and I saw them saw Jeff Williams. He's the CFO, I believe. And I was walking right past. I heard it out of my ear, and I'm like, AI doing billing, and I'm like, excellent, because AI is not going to be as good as the best human. I mean, it will get there eventually, but it's not going to be as good as the best human biller. But it can be a hell of a lot cheaper while the VC firms are doing it. And I'm like, and I didn't know of anybody doing that. I now know there's a lot more competitors out there, but so I started working with them, and yeah, they're a startup. They're on the earlier end. They pivot and things like that, but where they can scrape all of our claims and get them moving, or insurance verification has been a huge area where it's just repeating the same call, the same thing that we're paying. I might pay one of my girls. I'm in California. I pay even my front desk are making 30 to 40. I mean, it's insanity. And so, but I can pay Toothy. I don't know exactly what it is, but I think it's $6 an hour is what it averages, and that's not including that they're 24/7. You know, to do all my insurance verification. So I'm probably not saying what they actually do very well, but just seeing that they have this capacity to take over the insurance stuff.
I just want to stop for a second, Tom, and if you would, just for our listeners, maybe just give a quick overview of what Toothy does, of all the applications of Toothy, and what got you interested in it to start with, because you'd mentioned the billing, you'd mentioned insurance verification, but if you just give everyone kind of an overview of what it is that we're talking about, because I think this is, you know, we all think of AI in clinical, but we don't realize how much we spend, you know, for our admin team to try to get all this work done. So
that's a good, and thank you, because I was a little scatterbrained. I'm going to back up. I'm always looking for more efficiency. Always. I want my people to be people. I want technology to be the bad guys, and I want more efficiency as possible. Rather have Pearl be more aggressive than me. Okay, I'd rather have my front desk staff. I'd rather have them talking to patients. I'd rather have them, you know, doing that, making sure that my patients feel that little boutique care. They're paying a huge amount for my services, even though I'm reasonably priced. Dentistry is just expensive for your average person. We all know that, you know, and in my, so if I can have a computer do 80% of the, you know, do the easy work, which is 80% of it, and just do it faster, do it more efficiently. So that's sort of what I'm always looking at in any of these things. Toothy specifically. So walking by, what they do is they are software that works with your billing software. Okay, so they will integrate into Curve. They'll integrate into EagleSoft, into Dentamax, any of those, right? I mean, I don't know every single one. I'm not part of their company, but they work with all the major players in that regard. So what my experience is, I speak with the humans. They have a billing team just like any other remote billing team. Those are not new. That's been growing in the last 20 years as well, as outsourcing your billing. And they have a team like that have all come from experienced areas, and they look over my claims after the AI has scraped it, or in some cases as they build it up, because they customize it. So they build together. There's a little bit of a startup time, just like with any other language model or any other aspect of AI, where you actually customize it. You have some meetings with the humans. You talk with them about, I care about these codes being verified. I want to check this thing. I want to check this thing. I've found way more bone grafts being covered than I ever thought possible because we started to ask these questions where I don't want to pay my front desk have to call every single time on these niche codes that can be very profitable, but I'm not going to find them very often. But I'll have a computer do it if they're going to ask every single time exactly the right way. So we built a more comprehensive insurance verification form. And yeah, we took our lumps for a month or so where, you know, it might be wrong, just like Pearl might be or anything like that. And then the AI really starts to kick in, it starts to learn, and it gets much better. So, and then that uploads it automatically. By and large, we don't have to worry about it. So that was insurance verification where they are really top notch. They're as good as any other competitor in the market that I've worked with. I've worked with Next Health a little bit and things like that. They're real good there. On the billing side, what they do is they have a billing team like a remote biller, and as they can integrate AI, as they're comfortable building that in as well, they also release that to their AI model and get that moving. So they will, you know, you batch the claim. I'm on Curve, so you batch the claim, you get it ready, you close out the appointment, get that. They take care of it from there, and they basically tell you when they need to start needing you to do something in office again. I'd rather have Maggie, my office manager, give someone that personal call and say, you know, hi, Janet, I'm sorry we tried everything we know, but your insurance didn't quite cover this. Rather than having her on the phone with the insurance. So they take care of all that stuff. They're able to keep their fee at a pretty decent rate because over time, as they decrease your employee time that you're paying on that behalf, they transition to the AI, which is the cost of electricity at a certain point.
So,
Does that give a little more? I'm sorry.
No, I think you kind of nailed it and you honed in on it. But one of the things that I want to bring up with Toothy is, first of all, Toothy is run by probably two of the kindest and greatest people I know in dentistry. I mean, TJ is just such a freaking great guy, and Jeff's great too. And there's so many great things to say about Toothy. But whenever it always cracks me up. I don't get why companies don't understand this. And I'm going to throw out there American Airlines. I call American Airlines and and I'm executive platinum. I call and you get somebody on the phone right away. Hello, I have 6 numbers associated with your profile. Would you mind telling me your date of birth? You can tell it in the 2-digit month format, the 2-digit date format, and the 2-digit year format. And then all of a sudden you hear, and then it's like, oh, hello, Chad, how are you? And we're 6 minutes into the phone call. The thing about Toothy that's so cool is that when they start these phone calls, they call the insurance company and they'll get a human on the other end of the phone. We think they have no idea that they're talking to AI. And if they're AI, then AI is communicating with one another, and it's brilliant. There's no little, hold on a second, let me think about that. Yes, we do have insurance on John Smith, date of birth, XYZ. And so, I asked the people at Toothy how many times they get hung up on, and the rate's like almost next to none because there's no delay. That's how far AI has come. And in my opinion, for $6 an hour, even in Texas, and we're a lot less in California because our governor's better, but we're a lot less in Sorry, I had to throw it out there. That was a little no, but we're a lot less in Texas, and the thing is that it's still beneficial anywhere you are with what they're doing. It's a very innovative, calculated, and extremely beneficial product for every single dental practice out there.
Oh yeah. Oh, it's been great, and thank you for describing what it actually does even better because I kind of forgot. I didn't describe it.
You gave the nuts and bolts, but I wanted to give some details that really fascinate me about Toothy.
Yeah.
The other couple of things that I've done AI wise that I do have an AI I have an AI receptionist that only takes over so that that can do some rudimentary scheduling. I know there's a couple of competitors in that market too. What?
Is she hot?
Yeah, super hot. Super hot. That's the best. Yeah.
Wow, Chad.
This actually might be needed in dentistry because of the rate of the number of dentists who end up getting married or hooking up with their front desk people. Like maybe AI has a place.
We are a weird bunch. A few of us might end up going down that road with the computer.
We can
It happened with Joaquin Phoenix. It can happen with anybody. Okay.
But yeah,
that took a turn.
My dad ran off with the hygienist, so that's completely separate. My mom's a hygienist. So, anyway,
is she hot?
Sorry. Come on.
It was like I took the bait. He took the bait on that one. Sorry. Okay, go ahead. Go ahead.
Oh, it's a completely not dental related story. My brother, when he was growing up, he had this British soccer coach. Anytime one of the boys got a new girlfriend, he'd always say, "How's her cannons?" My mom, who's a great baker, made him for his birthday, their senior year, a boobs cake.
Yeah.
And said, "How's her cannons?" and icing around it. It was great.
And here I am thinking, what the hell is a cannon? Is it a British thing? I don't know. So.
Yeah, exactly.
Yeah.
So it's just because I am a loquacious person, I'll throw out some of the other things I'm working on AI-wise so that you guys can follow up with anything. So again, looking for efficiency or things like that. I have a receptionist who answers the phone if either they don't or if it's off hours, and they can do some rudimentary scheduling or get you schedule a call back. I've got I use Dentistry AI for scribe stuff. So I don't actually care if anybody in the offices does notes exactly with that, but I've told them you're using AI for your notes. I didn't tell them that their spelling sucks, but it is part of it. It's like your spelling sucks, and so they get even if it's ChatGPT and it's a private window, they put it all in there. We have better notes than we ever used to have. Things are in real words, full words, not little acronyms. A couple of things to work out on our titles of the notes, but like we have that. Perio charting is done. There's a bunch of competitors in that space, but what I really like there is not so much the verbal part of it and getting the AI there as much as what the AI does is it does a little pre-diagnosis from a perio chart. That's pretty easy diagnosis these days. They kind of make that pretty simple on the newer periodontitis stage and grading, but it gives this beautiful report to a patient so that we don't, because SRPs are just one of those things that have such a bad name if you Google them that patients always think they don't really need them. It gives a beautiful report that has summary statistics. You have bleeding in this many spots and blah, 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 that a patient can understand. Doesn't mean they're forced into doing the SRP, but it's just helping with education. So it's like, I have that. I was thinking of, let's see, I have those three.
Yeah, if AI is any good, the first thing it'll get rid of is the term SRP.
Mm-hmm.
Yep.
I agree with you. That is probably one of the scaling and root planing. Who wants that? Like, I'd rather have a root canal than scaling and root planing. It sounds awful. Like we put ourselves behind the 8 ball with that sale.
Yeah.
We should call it BAG for bleedy ass gums. And then
I like that.
Right?
Yeah.
Exactly. Right. Yeah. Yeah.
It's a solid diagnosis.
There you go.
I'm a member of the Petrified Plaque Club. So, hey, do you, with all this being said, I mean, and I know that with your AI, at least I'm assuming, which I shouldn't assume, but I'm assuming that you're utilizing multiple vendors for these AI services, right? Are you seeing, as much as the three of us are, how much consolidation is going on right now?
I'm going to have my shameless soapbox moment here from the boy who grew up in the same town as Google. AI is just Google 25 years later. If you knew how to use Google really, really well in 2000, 99, 2000, 99, 2000, there was Google, Bing, Ask Jeeves, Yahoo, dark web was probably easy to get on too. And it was this big old bubble, and we all know the .com bubble. And does it mean that The internet obviously didn't go away; it contracted. That's what AI is right now. It's it is. It's overinflated. I have some swings and misses in AI. I'm going to. It more fits my personality that I want to go be cutting edge. But there's going to be a contract. Yes, to answer your question, and I should have said yes to you guys weren't waiting on my answer. But yes, 100%, and that is the only way that this can possibly go. Is that the winners will win out when the times get tougher. It's going to go that way. There's going to be that contraction. There's going to be more. Getting ready for this podcast, I learned that my advertising company had more AI features than I thought, and they're working on an AI receptionist thing as well that's competitive with that. So, yes, unequivocally yes, and that's the only way it's going to go is yes.
It's funny because somebody just was affected by the AOL getting rid of dial-up internet. I don't want to say who, but I mean, like,
it was definitely
they just
wait. Who do we only hear every third word from on this webcast?
This guy down here.
That's a fair dinkum point.
You got mail, Chad.
I think I too will get on a shameless soapbox for a bit, because the same thing that we're seeing in all the software that's available for dental folks to use is the same challenge I'm now having in AI as well, is that there's all these different entities, which means it's 700 different fees that you're paying every month. It's 700 different phone calls that you have to make for support when you need help. Mm-hmm. And what I have found, and I hope there is consolidation, frankly, because as a consumer, it's unsustainable. I can't have 37 different AI companies operating simultaneously. But I'm not seeing the consolidation on the software side that I was hoping I would have seen by now, because I still have to have so many, because they all have their niche and they do the one thing like really well. And then they all redundantly do the other 27 things. So, I'm like, well, I would love to go with your company because I would love to get rid of these other 12 companies. But they each do something really well that you actually hadn't cracked the code on. But then you do something really well, but you all do the same other 27 things the same. And it is absolutely mind-numbing to me that I pay the amount of money that I pay every month. And I work with the number of vendors that I work with to solve 1 or 2 problems per vendor is essentially where we are right now. And I am also equally optimistic that we'll see consolidation, because I don't think it's not financially sustainable for the private practitioner. If they want to be innovative like you, and I think part of it is that's your passion, so you're willing to throw the bucks at it because it's fun and you're enjoying it, that the average practitioner is looking at that going, I can't afford $5,000 a month on, 700 software companies inside my practice at any given time.
Mm-hmm.
So,
absolutely.
So this,
I think
this sorry, dude, I'm cutting you off because you know what, you're done. I'm sorry. Love you, but you're done. I'm teasing you.
So unkind.
And you're only half cutting him off because every other word you say is not coming through.
Yeah. Are y'all still having issues with my sound?
No, we're just giving you shit.
I think we're loving your sound, actually.
Yeah.
Okay, good. So here's the deal. This is what I love about dentistry, and this is something that happened to me within the past week or two. And this is my advice. Even though Toothy's a sponsor, this is my advice to Toothy. I love consolidation. Every single one of us loves consolidation, because one thing that I freaking hate and despise and hope I never see again, even though I have 500 of them and I don't know what the hell they are, is subscriptions. We got a subscription to this. We got a subscription to that. We got a subscription to this. I was speaking with a technology company just last week, and I was telling them some of the services that we offer within our office. And they go, this is great, because we resell this, and this, and include it as part of your package. So you can go ahead and eliminate those subscriptions because now you're going to get it through this. Yep. And then the part of me says, holy shit, but I get this pricing through them, and I get this pricing through them, and I get this pricing through them. And then I've been with these guys so long, what's going to happen when we switch? We have it lined up to where nothing changes. If our price is better, you get it, but everything merges right in if you're utilizing, and I don't want to mention company names because that's not cool, but if you're utilizing X right now, since we resell X, it's going to all transition and it's just going to be under our umbrella and you're going to stop paying them. I love that. So that's my advice to Toothy, because I see Toothy being a part of so many bigger things, but I love that you can do that and keep your autonomy and be able to be under the umbrella of somebody else. We just got to figure out who's carrying the stick and who's under the umbrella. That's the hardest part to figure out for these companies.
And it's
sorry,
trying to be somewhat agnostic too, though, with regard, because there's so many practice, and that's really the differentiator, right? Is there's, you know, people are so dug in with their practice management system that you know, nobody wants to really let go of that. So, you know, you got to be careful about over consolidation to where you're, you know, you're just going down the rabbit hole with maybe one particular company that ends up alienating a bunch of other people. So it's not an easy road. I agree with you, Chad. I would love to see a lot more consolidation too, but it's a difficult path to not isolate a lot of people along that road, you know?
And I hope if they don't consolidate, that the little guys sold it for a shit ton of money.
Yeah.
And they didn't get screwed.
I think that, like, that very last point, I mean, it's you know, supermarkets didn't used to be a thing. They're called a supermarket because you used to have to go to a butcher and a baker and all that kind of stuff. They came together. People love consolidation. That goes way outside of dentistry. That's been, I mean, like you said, bringing in the specialty services. Everyone knows that that's huge moneymaker. People love that. But with these, it's, I think we're looking at kind of the startup model that you see again in Silicon Valley. And what are the two outs in a startup? Is either you get acquired or you go public. I don't think any of these are really looking at public, but the one thing, and something you referenced there at the very end, is I just hope that I do believe Toothy or whoever, they're gonna, you know, they're gonna get acquired. They're gonna get acquired. It's just, you really just hope they're acquired by somebody who uses their algorithms, if that's all that it is, and not buries them. And I do believe, and that's one thing where I try to throw my money in the people that I believe in, that it's like the companies that I did mention briefly, where I'm like, I do believe that all of them really believe in their mission. That I would hope, I'm not them, but I would hope that when they sell, because I do, you know, it's probably a when, or if they acquire others, that it's done with the mission being to expand how many people see that service, and not because it gets them the biggest check and it buries what was a great idea. But I that's the only other thing that I could see happening. But I see that.
I gotta say this. You bring up something I've never thought of until you just said it right now. Up until AI really took hold in a lot of these companies, and you could say even Align is a large AI company. There's a lot of AI with it. Like, there's a lot of companies that aren't AI companies that are leveraging and utilizing AI. But when they acquire now, to your point, like let's say somebody buys Toothy, you hope they're not burying that. What you're really also hoping is they're not burying that learning model, because it's been fed all of this information for however long to, you know, build all of this data. That is the value of AI, is that it learns over time. And you really hope that people, if they do acquire these companies, that they're then going to leverage that to take it to the next level, to unlock the deeper potential of that learning model and not ruin it, which has historically happened quite a bit with acquisitions. So, all right.
Great point. Well, guys, we have run all of our time out. Great conversation, Tom. Appreciate everything that you've done, and appreciate, you know, I know everyone out there that's listening always feels gratitude for people who go out there and try a lot of these services and are able to, you know, then kind of talk through the process of integrating all of them. So we appreciate you. And Chad, what do you say you close us out?
Yeah, first of all, I want to thank Tom for being here, and I'm going to throw something out there that I thought of throughout this that is kind of synergistic. A couple of companies that we both work with, but Tom mentioned that he uses Curve. I use Curve in my practice, and I'm thinking of kind of a technology roundtable with maybe Tom and Greg Wu, and maybe somebody from Pearl that we could talk about AI and how everything's kind of working and interrelated. I think it would be really fun. So let's do that. And I just, want to close with a couple of things. One of the things that we all, I don't do it on a regular basis, but I really am proud of the people at my office that do, which is insurance verification. So let's just use that for a second, because I've heard them on the phone with insurance companies, and I know how argumentative it could become. And I know how sometimes you get a little bit, put needles in your eyes. I know sometimes you can get a little bit hot-headed. Let's think about this for a second. I have Stacy up front, love her dearly, but man, if they push the wrong button, she wants to climb through the phone. One thing that AI does not have is emotion. Mm-hmm. And let's save the stress from a human being and a human interaction, and let's utilize Toothy to remove the emotion from those conversations. Not only remove the emotion, but remove the stress from those conversations for us, and just provide us with the valuable information, the nuts and bolts, and do it in a very efficient and cost-effective manner that actually may save a few seconds, a few minutes, a few years on the life of our employees. So anyhow, with that being said, I want to thank Toothy for being such a wonderful sponsor of our show. I want to thank them for introducing us to Tom. Tom, best of luck with the new baby, and I'd love to have you back. Do you know Greg Wu?
I know the name. I've never met him.
We're going to have you and Greg, and we're going to have a great spirited conversation on clerical technology and AI in the dental office. So thanks everybody for listening, and have a wonderful evening.
Good night.
Good night, everyone.
Good night, everybody.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.